Good morning. Today we will see the solved question paper of April 2021, that is of 2016 scheme. So in the first question, explain the staff requirement, physical and clinical facilities required to establish a school of nursing with annual intake of 60 students per batch. The teacher-student ratio should be 1:10 for the sanctioned strength of the students, excluding tutor for the interns, because general nursing course is having 3 year plus 6 month internship. So 60 students intake means 60 plus 60 plus 60. So total there will be 180 students. So 180 students, there should be 1:10, there should be 18 teachers, including principal and vice principal. So there should be 16 tutors plus 1 vice principal and plus 1 principal. So there will be 18 teachers and there should be 3 teachers for the interns. Intern also should be 60 students will be there. So 20 students can be taken care of by 1 teacher. So there should be 3 teachers should be there for the interns. And a school of nursing should have a lecture hall, a foundation lab, community health and nutrition lab, advanced nursing skill lab, OBG and pediatrics lab, preclinical science lab, and computer lab, multipurpose hall of common room for male and female, staff room, principal room, vice principal room, library, aviates room, faculty room, and provision for the toilets. And hostel provision is mandatory and shall also be owned by the institute within the period of 2 years. And hostel room, it should be ideal for 2 students. The furniture providing good a cot, table, chair, and a book rack, a cupboard, and cloth rack for each student. Toilet and bathroom facility should be provided on each floor of the student hostel at the rate of 1 toilet and 1 bathroom for 2 to 6 students. And recreation and visitors room and kitchen and dining room. There should be hygienic kitchen and dining hall to seat at least 80% of the total student strength at one time, with adequate tables, chairs, water coolers, refrigerators, and heating facility. Hand washing facility also should be there. Washing and ironing room and warden's room, telephone facilities, canteen, and transport facility. The school should have a separate transport facility under the control of the principal. 25 to 50 seats bus preferable, and a number of transports shall be as per the student's strength. And staff for the hostel include a warden, cook, and 1 for 20 students per each shift, kitchen and dining room helper, sweeper, 3, gardener, and security guard. And clinical facility for the School of Nursing. A School of Nursing should have a 100-bed hospital with the annual intake of 20 and minimum. The distribution of bed in different areas include medical 30, surgical 30, obstetrics 30, pediatrics 30, 20, and ortho 10. And the size of hospital of nursing home facility affiliation, it should not be less than 50 bed apart from having own hospital, and maximum 3 hospitals can be attached to one School of Nursing. Bed occupancy of the hospital should be minimum 75%, and other specialty facility for the clinical experience required are major OT, minor OT, dental, eye and ENT, burns, plastics, neonatology with nursery, communicable disease, community health, nursing, cardiology, oncology, neurology or neurosurgery, nephrology, etc. The short essay. First short essay is explain the process of controlling with relevant example. Controlling process. The controlling process include first one is setting performance standards. This simply means setting up target which needs to be achieved to meet the organization goals. These standards set the criteria for checking the performance. The control standards are required in this case. Second is measurement of actual performance. The actual performance of the employee is then measured against a set standard. With the increase in the levels of management, the measurement of performance becomes quite difficult. Third is comparison of actual performance with the standards which we have already prepared. So comparing the degree of difference between the actual performance and the set standard. And analyzing deviation, if there is any deviation from the set standard and behavior of the particular employee. Then taking corrective action if there is any deviation, this being initiated by the manager who corrects on any sort of defect in the actual performance. So these are the steps in the controlling. Then the second short essays describe the functions of management. According to Henry Fayol, to manage is to forecast and plan, to organize, to command, and to control. So where Luther Gillick was given the keyword for POTS, P stands for planning, O for organizing, S for staffing, D for directing, CO for coordination, R for reporting, and B for budgeting. But most widely accepted functions of management are given by Kuntz and Donald, that is planning, organizing, staffing, directing, and controlling. So that is means these five are the functions of management: planning, organizing, staffing, directing, and controlling, which is in detail explained in the other videos. So the first short note: factors affecting ward management. It includes good knowledge of the ward, a planned work schedule, starting day, work on time, preventing interruptions of nursing care, establishing a ward routine, democracy in scheduling and planning, introductory training and orientation to know personnel, maintenance of suitable environment, providing supplies and equipments in the hospital. Clear-cut orders for medical therapy and nursing care, record keeping and recording, maintenance of high morale of the nursing staff, establishment of good relationship with all the staff members, delegating responsibility, assigning duties and responsibility, and time planning, good teaching, good supervision. The legal responsibilities of a professional nurse. The first one include unintentional torts. This type of torts are accidents that cause injury to another person or property. Negligence. Nursing negligence are usually means of failure of nurse to take appropriate action to protect the patient from harm. Example: burns, falls, medication errors. Malpractice. Medical malpractice is an act of omission by the healthcare provider which deviates from accepted standard of practice in the medical community and which cause injury to the patient. Elements of malpractice. There are 4 elements to there. First is duty, that means in relationship the nurse's responsibility to provide care in the acceptable manner. So breach of duty, failed to provide care in acceptable manner. Injury, nurse act cause harm to the patient. Proximate cause is reasonable cause and effect can be shown between omission or commission and the harm. Intentional torts include: this type of torts are deliberate actions in which the intent is cause injury to another person. That include assault, then battery, then quasi-intentional. The third type is quasi-intentional tort. This is usually involving situations of communication and often violates person's reputation, personal privacy, or civil rights. The first one is fraud. Fraud is a crime or offense deliberately deceiving another in order to damage another to obtain property or service in the civil law violation. Nurse's role in administrative budget. Budget required for the nursing service department should be cooperative activity of the nursing superintendent and her associate, including the supervisors. It is prepared under direction and supervision of administrator or financial officer designed by him. The administrator supplies forms to guide the budget. The budget request may be broken down into different units like salaries, supplies, equipments, and other purchase requirements. The administration of nursing unit can have certain functions in preparations of budget request for program planning, estimating the cost, justification of request for the administration of budget in the nursing unit. Preparing requirements. Nurse administrator should prepare requirements with assistance of her subordinate for the coming year from the supplied informations by them. Summary of new needs. Nursing administrator should prepare a summary of new needs and requirements, both personal and material, with proper data support of the requirements. Submitting to the institution administrator. The budget should be submitted to the administrator of the institute for review, decision, and to incorporate into master budget required for the hospital. Responsibility of the nursing administrator: preparation, participation in planning, consultant and take assistance of her subordinate, request sufficient fund to suggest sound programs, suggest to provide developing program provisions, expansion of program to attract and hold qualified staff, to provide for expansion of physical facilities, supply equipments, etc. Submit budget request with justification with proposed expenditure. When the budget is allotted, the administrator should support the budget. Once the budget is adopted, it is the responsibility of the administrator to see that expenditure should not exceed the appropriation as made. Assistant her subordinates. Nurse administrator required assistance of the subordinates, review the budget and ascertain the change. She requires to ascertain whether any change contemplated, just opening new facility for the patient, changes in the department, etc. Nursing care standard. According to ANA, the standard is described as a criterion in the agreement on an acceptable level of practice for the established norm. Standards of care or standards of practice in nursing are general guidelines that provide foundation as to how a nurse should act and what he or she should be and should not do in his or her professional capacity. Deviating from this standard can result in certain legal implication. Professional standards describe the competent level of care in each phase of the nursing process. The main purpose of the professional standard is to direct and maintain safe and clinically competent nursing practice. These standards are important to our profession because they promote and guide our clinical practice. Importance include standards are the fundamental building blocks for product development by establishing consistent protocols that can be universally understood and adopted. In summary, standards are the fuel for the development and implementation of technologies that influence and transform the way we live, work, and communicate. In case of nursing practice, standards are established criteria for practice of nursing. Standards are the statement that are widely recognized describing nursing practice. A standard is the performance model that results from integrating criteria with norms and that we use to judge the quality of nursing objectives. Basic principles of standard are: standards should be designed to achieve stated purpose. Standards should be based on clear definition of professional scope and accountability. Standards should promote fullest development of a profession in accordance with potential social contribution. Standards should be sufficiently broad and flexible to achieve their objective and at the same time permit freedom for innovation, growth and change. Standards should promote universal level of performance and encourage professional identity and mobility. Standards should recognize the equality and interdependence of professions offering essential service. Standards should be formulated according to requirement which facilitate their applicability and use by the profession. Source of standard include professional organizations like TNAI, licensing bodies or statutory bodies like INC, institutions or healthcare agencies, department of institution like Department of Nursing, patient care unit, government units, national, state and local government, individual that is personal standards. Classification of standard are the structure standard, process standard and the outcome standard. Role of head nurse in maintenance of supplies and equipments. The head nurse is responsible for keeping an adequate amount of equipment and supplies in the ward. Make sure that equipment and supplies are in good condition. Put the requisition for necessary equipments for repair and maintenance when needed. Make sure that equipment and supplies conveniently located. Make sure that all personnel in the ward should clearly know who may use the ward articles and equipments and who assume the responsibility for it. The head nurse must be vigilant and prevent waste or misuse by educating her staff in economical and appropriate use of all equipments and materials. She may sometimes arrange the ward class to enable the staff to know the cost of equipment and material. She takes 3 steps to ensure adequate stock available that are: set standard for the quantity of each item to be maintained, have a satisfactory system of replacement or ward, make regular inventories of all time. And difference between administration and management. Management means getting the work done with others. Administration deals with formulation of objectives, policies of organization. And management refers to execution of decisions. It is the doing function. But administration refers to decision making. It's a thinking function. Management decide who shall implement the administrative decisions. Administration determine what is to be done and when it is to be done. Management is relevant at lower levels in the organization. Administration refers to the higher levels in the organization. An autocratic leader and a democratic leader. Autocratic leadership is one where the line of democratization exists between leader and his followers. All the decisions are taken by the leaders only. But in a democratic leadership allow the type of leadership with which leader shares the decision of making power and other responsibility with the group members. It is a centralized Authority, but democratic is decentralized. The behavior, it is task-oriented, but democratic is relation-oriented. And appropriate for the subordinates, unskilled, uneducated, and obedient, but democratic is appropriate when the team members are experienced, qualified, and professional. List the following. First one is principles of planning. The principle they include commitment, limiting factor, reflective thinking, flexibility, contribution to enterprise objective, principle of efficiency, selection of alternatives, planning premises, timing and sequence of operation, securing participation, principle of perseverance, strategic planning, innovation, follow-up. Next is source of recruitment. There's two sources of recruitment, that is internal sources and external sources. Internal sources means from the previous applicants, present employees by the transfer or promotion, employee referrals and formal employees. External source by the advertisement, campus recruitment, e-recruitment, employment exchange, walk-in and write-in in contractors, acquisition and mergers, professional associations and mergers and acquisitions. Answer briefly about delegation. Delegation is an authority. Authority is the process wherein manager assigns responsibility to its subordinate along with certain authority to accomplish a task in the manager's behalf. That means in the absence of the manager, the subordinate has to perform particular duty. The process of delegation is stage 1. First is the assignment of particular duty and transfer of some authority to the subordinate, acceptance of his duty, and he should be accountable for what he has been done. So assignment, transfer, acceptance and accountability are the process of delegation. The principles of delegation include scalar principle, absoluteness of responsibility, unity of command, parity, authority and responsibility, result expected, functional definition and exception principle. Work culture. Work culture is a concept that the world deals with the elements that make up an organization. It is a study how the interactions among the employees at workplace affect the way of organization function. An organization is said to have a strong work culture when the employees follow the organization's rules and regulations and adhere to the existing guidelines. However, there are certain organizations where the employees are reluctant to follow the instructions and made to work only by strict procedure. Such organizations have a weak work culture. In layman's language, work culture refers to mentality of the employees which further decide the ambience of the organization. Importance of work culture in role. Work culture has a direct influence on how the employee fits into the organization, as well as the organization's ability to attract and retain employees because it shapes the environment they work in. Then good work culture offers everyone an opportunity to initiate change and grow on a more professional and personal aspect, and it also leads better productivity levels among the employees. Thank you for listening.